Yeah, dear medicos, we are having the honor to have Dr. Rajnandini with us, rank 7, INICT. So, beta, first of all, congrats for this awesome achievement.
Thank you, sir. Thank you so much.
So, beta, after getting the single digit rank in top 10, how you are feeling? On the top of the world?
Sir, extremely happy.
That's great, beta. So, we will be using this platform just to share your success story, and all the juniors who are listening to you. What was your strategy like getting the single digit rank? The first of all, let us crack this INICT paper was difficult. I say it was one of the most difficult paper in the last 5 years. So how you managed to get this single digit rank in one of the most conceptual paper? What was your strategy?
Sir, I started my preparation, like typically the PG preparation late. That is after my internship, which ended in February 2020, following which I started in March 2020. And my preparation was not very proper till the end of 2020, I would say. I got a rank of 1533 in the INICT July 2021. And in this NEET PG, I got a rank of 1600. So I was quite disheartened when my rank dropped down from the July INICET to this NEET PG. After which I decided that I probably might not be having a good strategy, or I was lacking in solving questions. So I found that very important because I had prepared, I had read my notes, I had proper information, like whatever information was needed, I had that. But somewhere I was lacking in solving MCQs. That proper MCQ solving skill had not developed by that time. So I decided that let's solve more and more questions between this NEET PG to this INICET November. And I think that is what helped me immensely in getting this rank. And this time the paper was definitely more conceptual, and definitely you had to analyze each and every question. Even the slightest of nuances in the question stem proved to be of utmost importance. So I think that is what helped me this time.
That's great, but what I'm getting from your words, like you got somewhere 1500 rank in the last INICT, then your rank dropped. That is this interview. I think these words will be a big motivation for all the students who couldn't perform in the last NEET examination or this INICT examination. Okay, you had a very awesome comeback from like somewhere 2000 rank to rank 7. That is one of the great achievement. And you are saying कि you highlight, this is the best part which I'm getting from your words, कि बेटा आपने observe किया कि there was lack of MCQ somewhere, so you concentrate more on the MCQ spell in the last INICT, and that proves to be very successful. That proves to be the game changer. That's great, beta. So let us start, beta. Like you got ranked 1500 somewhere in the last INICT, and this you are getting. So you use all the online test series and grand test of DAMS and all CBT. What was the experience, beta? Like let us start with the quality of MCQs. Like you were saying, questions paper last INICT was the most conceptual paper, was more difficult paper. So what was the role of the grand test, role of online question paper you attempted in this last INICT?
Sir, the online test series at DAMS that had many subject-wise tests also, and which had grand tests also, and several mock tests also. So I used, I couldn't finish all because there were multiple tests, but I finished mostly all of them. So I finished a lot of subject tests as well. So what I found was some of the papers were quite difficult. Some of the papers were moderate. So there was a balanced mix of everything. So what I felt was, even if you're facing a difficult paper, if you do not lose hope, like in the very first few questions that, okay, I'm not being able to solve this question, so probably I'm not going to have a good paper. I think that is the most important mindset that one can have, because if you're disheartened in the very first few questions, then I think that mindset will not let you do better in the paper. So I think that was when DAMS came into play. And also this last CBT, that was the previous AIIMS PG pattern, wherein there were separate true falses and many other things. So we had to analyze each and every statement individually. There were no permutations, combinations, and single best response. So there were multiple best responses. Then there were match the following. So all the previous patterns, so which also helped me, because every time you cannot rely on the options to come to an answer. So you must, and also I got to know which topics I was lacking in. So which topics I required more depth of knowledge. So I think that is how it helped.
That's great, beta. So like the paper was very conceptual, paper was on the difficult side. So let us first part of this discussion. I'm just taking your word. Okay, what was your strategy of attempting the MCQ? Like pattern is changing day by day and we people DAMS adapted to the new pattern. So what should be the strategy? Like a paper, the MCQ, what should be the strategy to crack the MCQ? First part, I want to take your feedback.
So MCQs, first of all, you need to be thorough with your concepts and notes as well. But that is not the only part, because I think the practice of MCQs and the practice of how the information is asked in the form of questions and how you can translate your knowledge into getting an MCQ correct is more important for these exams. Because many a times, like from my experience, I can say that in the previous few exams, when I had solved less number of questions in my regular preparations, I had difficulty in managing with the time as well, which is why in the last INICET, I had attempted approximately 180 plus questions. Whereas in this INICET, I was able to attempt 199 plus, like 199 questions in good time, not too early, but I just finished on time. And I had time to review the paper as well, the questions which I found difficult or the questions which I had marked for review. So I think that MCQ practice allows you to have a good hold over like those 3 hours and 180 questions can seem difficult. But then I think if you have given good number of grand tests and if you've practiced good number of questions, I think those one-liners and those questions which require less than a minute, you'll be able to save much of your time for the questions that actually require analysis.
Very true and very deep analysis you are telling us. Okay, yes, one point I am getting from your words, okay, we should be very aggressive. We should attempt as many as possible. Like rank 7, that's in INICET, is not a is one of the, you can say, best achievement in your life. So this what I'm getting, okay, you be aggressive in the MCQs, try to attempt as many as possible, but that will be only possible when your basic concepts will be clear. Coming back on the revision part, better, like in DVT and all those platforms, we try our best to motivate the students to revise. How many times you revise your notes before going for INICET?
So I revised them nearly 3 to 4 times.
3 to 4 times.
And some subjects, even I think more than that, especially the short subjects, because they are possible for revision like from cover to cover. Because subjects like medicine and surgery and gynae obs, it's very difficult to revise cover to cover each and every time. But short subjects like forensic, like ophthalmology, and the final year short subjects, even I would say ENT and those subjects also, you can revise cover to cover if you want. And those subjects actually turned up to be very important in this INICET paper, because there were many questions and quite, I would say, moderately difficult questions from forensic, from orthopedics. Even anesthesia played a very important part in this paper. So I think a revision of short subjects is very important, and it is absolutely not a good idea to leave out on any of the short subjects, because I think even if you do medicine selectively, which was the strategy for me, that you do medicine, whatever you find high yield and whatever you find is repeated in the paper multiple times, things which you cannot leave out, rather than trying to complete everything, because no matter how much you study medicine, how much you study surgery, there will be some questions, or there might be some questions which you're not able to answer. But short subjects, if you do cover to cover, I think you'll be able to answer, if not all, at least most of the questions.
What I'm getting from your words, Kevita, you are telling the importance of the short subjects. So I always share, even in my sessions, first line of batsman should be your basic sciences, and the next line of batsman should be your short subject. So now coming on the basic sciences, like you told me, anesthesia, ortho, these subjects were very important and we should revise from cover to cover these short. So, and it is very much possible. It is very much possible to revise cover to cover short subjects. Now coming on the basic sciences, like pattern is changing. Every student somewhere, even in the third year, they are interested in knowing what should be the golden pathway on which we can get a decent rank in the NEET or INICET. So beta, what is the role of your basic sciences in the last, like you appear for last NEET, you appear for last INICET. So in this new pattern, what is the role of basic sciences and how the student should cover these subjects?
So I would say very important, because this time also in the paper, there was a balanced number of questions from every subject. like, and the basic sciences were very important. Like this time in the paper, I found, like, for example, pharmacology. If you had studied pharmacology well, you could have got at least 7 to 8 questions correct, which is a huge number in a paper of this kind. And for example, if the questions even are from medicine, if you are thorough with your pathology, if you're thorough with your pharmacology, and if you're thorough with physiology, I think you can solve maximum number of questions from medicine, because everything is not very clinical. Most of the stuff is conceptual. So if you have your basic sciences correct, I think you can solve many questions, even anatomy, even biochem. There were many questions from anatomy and biochemistry as well. And molecular biology happens to be the favorite of the INICET examiners. So
Yeah.
I think basic sciences would have a very important role.
So we should.
And even microbiology, I cannot miss out on that. I mean, extremely important.
So, Beta, what was your strategy for these basic sciences? Like, I'm a first year student. I'm listening to your words. How I should proceed for the anatomy, physio, biochem, or path micro? How basic sciences should be approached? Like, you are the best candidate. I'm proud to share a Damsonian getting ranked 7, top 10 rank. Awesome achievement. So, how we should handle these basic sciences, Beta? There is a big phobia for basic sciences for everyone. So, what should be the approach?
So what I did was I would focus on that particular year. Like if I'm in the first year, I would focus on anatomy, physiology, biochemistry equally and refer to standard textbooks for them. Because I feel standard textbooks are more lucid and easier to understand than any guidebook or any other material which is available in the market, I would say. And once you get your concepts right, I think half of your job is done when you go into your pre-final and final year. So for me, I would do those particular subjects very well in their individual years. And I think in the second year, you have nearly 1.5 years to do your pathology, pharmacology. So I think Robinson, other standard textbooks for the individual subjects can be done. Like you don't need to read them multiple times or revise them multiple times. But if you refer to them originally for your concepts, I think that is very important. Gradually, as the exam, the pattern is changing, the more and more conceptual and more clinical questions coming into play. I think basic sciences would play a very important role, and getting your concepts right from the first year would be very important.
Now, coming from the basic sciences to the final year subjects, like Beta, okay, what should be the approach to the medicine, surgery, gynae, obs, and what was the, you can say, role of these subjects in your success rank of 7?
So I would attend my clinics well. That is the first thing I would say. I was not a very studious student in the pre-final and the final years. But yes, I read whatever was necessary for my exams, like whatever concepts I required or whatever was absolutely necessary for my exams. I made sure I knew all of that. Not going into very great detail in my final years. I'll be very honest. I did not study much in depth in my final years, but yes, I would attend my clinical postings and read from standard textbooks, whatever was necessary. So I think that if you're doing in the pre-final and final years, I think that should do good for you.
That's great, Beta. You are very honest. You are telling we should focus more on the clinics. And this is again a strong message we are delivering on this platform. We should not miss our clinics because the pattern is changing. There is a more role of clinical learning. And if you are going in the clinics, you will be applying all those concepts from your textbook. So it will be more comfortable for in the MCQs. Now, coming back, Beta, on this preparation strategy, like students who are preparing for the next NEET examination. Now, what I will be using this platform for those students who are saying like 4 months or less time is there, the exam is declared, next NEET examination. What should be the strategy for those? Like you are the best candidate, you can, like if you are going now, I'm confident you are joining your dream branch in AIIMS Delhi, but if or and the Central Institute, good, what is your dream, Beta? Joining AIIMS or JIPMER? AIIMS Delhi. So first of all, welcome to AIIMS Delhi. That's great. So now if you would be going for the next NEET examination in next 4 months, what would be your strategy? Like what every student who is preparing, who want a master plan, okay, how I should proceed in the next 4 months. So can you give some tips on those strategies, Beta?
Yes. So first of all, I would say that if in case your first reading isn't yet complete, then you should focus on completing your first reading, whatever possible. within December, not more than that. And if possible, like when you're halfway through December, you should be done with your first reading or whatever you can do. Like, don't try to finish everything, because I don't think that would be possible. Like, if I had to appear for NEET, I wouldn't be going beyond December with my first reading. I would do whatever possible within December and then simply revise. Because I feel that if we can't revise before the exams what we have studied, then we might as well not do it, because we are not going to remember anything anyway, because the subjects are so vast that if we don't revise them, like not once, but at least twice or thrice, we are not going to be able to retain much.
Examination.
So I think be done with your first reading within November, at least within December, and then just revise the whole day and nothing else. And while you're revising, you should be solving MCQs in a day. Like what I did in the last few days, I solved more than 100, I think maybe 200 or 250 plus questions in a day. And I think that helped me a lot to jump back from a 1600s to a single digit rank. So I think that is equally important. So revise your notes, because sometimes revising notes the whole day gets very monotonous. So I think question practice will be able to do the thing for you. And practice questions, do your notes. Like I would go from my weak subjects to my strong subjects. For example, if I find pharmacology very volatile, I would start with pharmacology. Whichever I find the most volatile, I would read all the highlighted parts of my notes and not go into new information now. That studying new stuff is not important. Getting your basics right, which again has been proved in this exam, I think is more important. So weak to strong subjects along with the question bank, whichever platform you're using, questions from any platform, I would say. You can solve questions from anywhere. And then GTs, yes, definitely, if possible, 2 GTs in a week would be good. But then I think 15 to maybe 1 month before the exam, just cut down on the number of GTs, because sometimes when you're not getting probably a very good rank in the GTs, your confidence might drop down. So in the last, at least in the last 2 weeks, don't go for a GT. But yes, do solve questions. And revision, I think if I were to give NEET, at least 3 revisions I would target, because it is somewhere in March. So 3 revisions I would target. And short subjects cover to cover, because they can be done in a day.
Thanks a lot for giving all these awesome words for all the juniors, and your success journey from 1500 to rank 7 is, I think, is a big motivation for everyone. So at the last, any special message for your family members who played the most important role in your success journey?
Yes, definitely family members, because after the NEET, when I got a rank of 1600s, I had pretty much given up, that I'm not going to prepare anymore, that I'm just going to see which college, which branch I get with this rank. But I'm glad that I didn't give up finally, and I listened to my parents, and I just thought that, okay, before 2021 ends, let's give it a last attempt. And after that, I'm not going to sit for any exam. So I'm glad that I did it. And I think not giving up is very important while you're preparing for your postgraduate, because this is something very important in life. And you should not be regretting that had I prepared for 1 or 2 months more, I could have got into a better college. I could have got into my dream branch. So whatever you feel like doing, just do it now, so that you don't have any regrets later on.
Thanks
and
a
get
lot.
your concept straight.
Thanks a lot. Thanks. We are proud to share rank 7 on this platform. And Beta, thanks for giving such an honest motivational word to your juniors. We wish you very best of luck. Thanks a lot. Thank you.
Thank you so much, sir.